Thank you, Kelly, for asking me to speak today. For those of you who don't know me, as Kelly said, I work in radiology. You probably saw me the majority of the time in outpatient surgery. I feel very humbled and very honored to be able to speak to you today about the things from my heart. This is a very important subject, the heart. Now, just so you can relax, you don't have to worry. This is not anatomy and physiology class. I'm not going to be doing any browbeating, so to speak, on what you should and shouldn't do, but just keep in mind, I do see what a lot of you eat, and I ate the same way, so I'll try to be kind. The information I'm going to give you today is given you in hopes just to make you more aware of the situation. A person never knows what life is going to hand them. Have you ever looked back at your childhood picture? Oh. And thought, wow, little girl, if you just only knew what you might see or experience through your life. This little girl saw her father pass away when she was young. She never had a chance to go to college till she was like 35. She went through a bad time of infertility in her marriage, which resulted in divorce after 17 years. And then she met this really wonderful man. And he's a godsend. That's all I can say. So you get the idea. This little girl's me. As you can tell, we were pretty pitifully poor. But
the pretty blonde hair.
As I grew, it grew. Yeah. I started out so blonde and then went brown, and then here I am.
I heard what this morning was.
$6.99 out of the bottle now. But thank goodness we don't have to know what's ahead, or else we would probably run. And so on April the 20th of last year, I decided that I was going to knock off a couple things on my bucket list. So I set out to do a 3.5 40 obstacle mud run. Now 3 years ago, I was diagnosed with asthma. But in those 3 years, I had only used one inhaler. So if anybody in here has asthma, you know that's probably not a really true diagnosis, maybe. I think it may have been missed because one inhaler in 3 years just didn't make a lot of sense. So, but this was something I still wanted to do. So with inhaler in hand, I took my puff. We got in our positions and only used it one other time. I finished the race, obviously, because I am still standing, short of breath, but alive. And so keeping that in the back of your mind, let's fast forward to 13 days. My life verse comes from Jeremiah 29:11. For I know the plans I have for you, saith the Lord, plans for welfare, not for calamity, plans to give you a future and give you a hope. I believe this with every bit of my heart. After working on that Thursday, May the 2nd, I decided that with my type A personality, that I was going to keep going. I need to go home, need to get some things done. So I decided that I was going to mow the lawn that day. Now the lawnmower, as you can probably tell from my picture that Kelly used in the advertisement, our yard doesn't look very big, and it's not. You can usually finish it in 30 minutes. But that particular day, it took me 3 tries to get my lawn mowed. And the lawnmower just kept feeling heavier and heavier till at one point, instead of, pushing your lawnmower, I was out almost prone, just with every inch of push that I could get. But nothing hurt. I just felt like I had cold air that was cutting through me, kind of like it is when you step out into the cold air. So after that, I thought, well, I'll just go upstairs. We had guests. I thought I would just finish changing the bed sheets that I just gotten out of the dryer. And so I'll go up to the top of the stairs, and I'm like, whew, boy, I'm out of breath again. So I just sat down for a few minutes at the top of the stairs, and then I thought, okay, I can do this. So I got up, and I got the bed made after 2 tries, and then I just decided to call it a day because this something wasn't right. This was not a typical day for me. My dad died from a heart attack when he was 49 back in 1968, and I was 13, so that ages me a little. Back in 1968, we didn't have all the health warnings that we have now. I actually Googled some of when cardiac caths started, and they started a long time ago, but they really were not perfected, so he didn't have that option like I did. But for granted now, he smoked. Both my parents smoked. We raised tobacco. We had a 30-acre farm. We're Tar Heels. We're North Carolina born and bred with our tobacco and everything else. And we ate off the farm, so I grew up eating all the red meat and everything else that you could possibly eat, and it was fried to the hilt. So he wasn't obese. He had no family heart history that we know of himself. So my doctor had always asked that I kind of keep a lookout on some signs for things, because not only he had had a heart attack, but my brother at 68 had had triple bypass, and he's now 74. But so I just kept thinking, I eat right, I exercise, I'm not overweight, I'm not a diabetic, I don't smoke, so I really wasn't that concerned. My numbers weren't that bad, I thought. My total cholesterol, because that's usually the first question people ask, well, what's your cholesterol? Was 211, and you know 200 is kind of the cutoff. My HDLs were 40, that's your good cholesterol, which that was good. Now my LDLs, which nursing calls the lousy one, was 136, and they like for you to keep it under 100, so it was borderline. So I had the mindset that I could eat right and exercise, I could control what I put in my mouth. And I still kept thinking, I'm going to be just fine. So before the mud run, trying to get in better shape, because you see some of the obstacles, and that was my friend Vita, who was pulling me over the pole, which was about as tall as I was. I would notice when I would do anything strenuous, the thumb and the pad of my hand would just ache and burn. And then my jaws never had the jaw pain, but it was like I would just wanted to grimace and just bite down. It's just like it needed to pop or something. But that was really the only thing that I had that showed me any kind of signs, and I really, again, did not think a lot about those. Thinking this was kind of odd though, I was getting ready to go on a mission trip before the mud run, so I was trying to get everything all in, you know, make sure I was in good shape. And so I decided to go to the cardiologist, and I told him what it was, and he says, well, does it stop when you stop? Yes, it stopped. When I stopped running or I stopped doing anything, it stopped hurting or aching or whatever. So he said, don't do it, you know. But if it keeps doing this, we'll look at it, and if we have to, we'll do a heart cath. So I continued with my normal, usual daily activity, went on my mission trip, and just went on about life. On May 3rd, when I got up to get dressed that morning, we're now on Friday, I looked and I thought, I got up and I looked in the mirror. I didn't have my contacts in, so I went like this, and I went like that, and I thought, wow, you look rough. You know, I knew you'd just gotten out of bed, but I was so pale. But I thought, you know, with a little bit of makeup, women can usually fix that problem. So I decided just to do that, and I just came on into work. As you know, there's a lot of walking with the radiology nurse. That particular day, I had walked over to MRI, for those who know that is on that side of the building. And I was headed back towards cardiopulmonary, as you know, is way over at the ER. So as I was headed back, I thought, man, I am just so out of breath, but I still didn't hurt. I still didn't ache. Nothing was any signs yet. And I just kind of leaned up to the wall, and a friend of mine walked by, and they looked at me, and I'm like, I don't feel good. I think I need an EKG or something done. So that's when the plans for my life changed. Now, I am not a good reader of strips. I'll be the first to admit I'm improving. But I can read the printed words that said, cannot rule out anterior infarction, consider T-wave abnormalities. And I thought, this is not good. So I went back to the office, called my cardiologist, which happened to be across the street, and they wanted to know if I was having any active chest pains. I'm like, no, but I feel bad. I'm just so out of breath. And they said, well, just come on over at lunch, and we'll see you at lunch. So when I got there, I must have really looked pretty bad, because before I knew it, I had an IV in my arm and aspirin, 3 nitros, even though I still didn't have chest pain, and another EKG, which at that time showed almost no T waves. The T waves were actually almost just flat. And not looking any better, he just looked at me and he says, I think we need a heart cath. I said, well, I will call my husband and tell him, come get me and meet me over there. Because for granted, I drove from here to the hospital to the cardiologist, and which probably looking back was not a good thing, because as I was driving, I felt like the car was just kind of on air. It was really weird feeling, but anyway, so I was floating. But anyway, he said, no, he says, you're going to go in the ambulance and your husband can just meet you there. But my husband was able to get there and see me before they did anything. And at that point, after speaking to him, I had a real important matter I needed to discuss with him and everything, and it was please, please, please call the mulch man. He's supposed to be at the house at 3:15 today, because we got to spread our mulch tomorrow. So anyway, all that was taken care of, and after hugs and kisses, they took me back, and that was really a lot. I don't remember a lot after that. The next thing I do remember is hearing the doctor say, I cannot fix this. And I guess I was just awake enough from the verse ed to hear that. And I just kind of looked over and said, probably in a drug sense, you can't fix what? And he said, look to your left. So I looked to my left at the screen, and what I saw, he said, look to your left of the screen. Your vessel has no flow going through it whatsoever. So at that point, I must have been given some extra little medicine, probably for being so nosy, because I don't remember anything after that except waking up again. When I woke up in the room and started asking questions, I noticed that there was a heparin drip hanging, and I asked them, what did they find, what's been found, and they said, my husband told me, he says, you did not have a heart attack, but you do have 4 blockages. And the blockages being 100% in the right coronary artery, 90% in the left side, another 90%, and an 80%. So they're going to do open heart surgery on you Monday. And they're going to keep you on the heparin, keep you on bed rest. And I thought, wow. And I was just thinking, maybe a few stents here. I was going to be good with that. But thank goodness it wasn't a heart attack. My ejection fraction was 55%, they told me, which was good. It was just the plumbing. It wasn't the heart itself. So for that, I'm very thankful that there was no heart damage. At that point, things started going pretty fast again. Setting up and meeting the cardiothoracic surgeon, the lung specialist, and all the people in between. But all of them just kept asking me this question, and I'm like, where y'all coming from here? The mud run. Everything was the mud run, and it got to be kind of funny, because now it was all through the hospital that I had done a mud run 13 days before. And after anyone having any contact with me about the mud run, they know that I enjoyed it. I would do it maybe again. I don't know, but that did play a big part in the way things wound working out. Because, you look at that. Look at that picture. Is there anything there that could hurt you? Really. This is some of the pictures here. A few of the things. Again, I'm still thinking, on what God had promised me. Now, He promised me the plans for a hope in the future. But I also remember what He had told Jacob. And it said, He told him, He says, you will pass through the rivers of the waters, and I'll be with you. And He said, they shall not overflow you. And you will walk through the fire, but you will not be burned. And neither shall the flame kindle you. And I was good with that promise. I had already been through the waters, and I felt like I was getting ready to go through the fire, because when I look at some of these pictures now, I think back, we had fun, we had a great time, but at one point my head could have went straight under those waters and not come back up with a heart attack. So just keeping that in mind. Also, I always remember what my mother had told me, who's with the Lord now. She said, there is always somebody worse off than you. So, and with that, she was right. So now we're at Monday, May 6th. And just to mention, Monday, May 6th was a special day to all of us registered nurses and anyone in the medical field, LPNs. This is Nurses Day, May 6th. And with that, I just wanted to put a little heart that said, this is my Nurses Day present. So May 6th will always hold a special place now, not just because it's Nurses Day, but it's because of the day I survived. I remember kissing my husband bye that morning and saying to him, now remember, there's somebody a whole lot worse off than I am. I love you, and I will see you in a few minutes. And I left him in great hands with the Lord. I believe that with all my heart. And I left him with 18 friends from our church and some family members, because we don't have biological family here. My family came that was able, but the rest of them were church members. You know, you don't know how much you're loved until things like this happen. Now, there's huge advantages and disadvantages to being a nurse. I had seen a lot of ORs set up before, but when I entered that operating room and I looked around, and I'm used to seeing these little tables with a few things, and I looked around and there was like 4 tables filled with instruments, not just 1 or 2, but lots of them. And I saw the heart-lung machine, and at that point it kind of said, this is all yours. So I decided that I was ready to go back to sleep, and I didn't care. So I remember going back, you know, doing the counting backward thing, and then that was it. In the, I'll get to the next slide here. This, hope it doesn't gross you out, but this is myself in the step-down unit. All I remember was waking up with that tube in my mouth, as you can see it, and being the nurse that I am, and probably the rest of you nurses would do the same thing. I'm sitting here going, I'd woke up just enough, and I was doing C, because my hands were tied down. I couldn't get up very far, so I was doing H, and I was going like this, and O, and my sweet little husband says, I think she's choking. She's saying she's choking. She's spelling it out. And again, back to sleep. Boy, you say one thing or do one thing, you are back out, which is a good thing. It's a real good thing. So I don't remember much more after that. Also, except when they took the chest tubes out, I remember asking the nurse, "Are you going to do this?" You know, and she said, "Yeah, me and another nurse." And I'm like, "Oh, okay, there's 2 of you, okay." And I thought, "Oh my goodness." Well, with no pain medicine on board, she said, "Now on the count of 3, we're going to pull this out." And I'm like, "Really? No pain medicine? You're going to be fine. It'll be quick." So on the count of 3, 1, 2, 3, I felt the tubes come out, and I heard this sound, and I thought, "Oh my word, you have just deflated my lungs," you know. But that was, you know, didn't happen, and there was more to come. After the chest tubes came out, the art line came out, the tracer lines came out. I feel like there was not many more orifices I had any things that could come out of. I was able to get up and move around with my lovely heart pillow, which I would not take anything for. I was doing great, but the surgeon kept, he was kind of concerned because my hemoglobin was 8 and he couldn't figure out. He said, you didn't lose a lot of blood. And he said it was very minimal, and he couldn't figure it out. So I kept thinking, I thought, oh, I forgot. I gave blood on Tuesday before all this. So now I've had the mud run, I gave some blood, I've had my open heart surgery. And so it was, a friend of mine had told me afterwards, the anesthesiologist had said, with all of that, I should not have lived. And all I can say to that is God not just wonderful? I came home on that Friday, and with the best husband any woman could ever ask for by my side, the healing process was to begin. that part was nothing compared to some that was headed. This man of mine, he stuck that incendiary spirometer in my face every 2 hours. I was about ready to let him use it, but but he walked with me. He I had certain distances I had to walk within, like the next week after being home, things like this, and I slept in the recliner for 9 weeks, and in those 9 weeks. He never one time complained when I yelled, "I can't get up, I gotta go to the potty," at 2 or 3 o'clock in the morning, And I couldn't dress myself. I could do this, and he could work my t-shirt over my head or something, because we were not allowed to do this, and we were not allowed to do this. So you couldn't reach back. And I remember one morning in the shower, and this is with his permission, I can tell this, he was drying me off, and I just started busting out crying. And he's like, "Hey, what's wrong? What's wrong?" And I'm like, and he said, "Did I hurt you?" And I'm like, "No, you'll never look at me the same again. I got this big old ugly scar. I got these 3 scars going down my leg." And he's drying my back off. Being a comedian he is, he says, "Well, honey, I think we got bigger problems." And I'm like, "Now what? What's wrong? What's wrong with my back?" He's like, "There's like this big old crack back here, y'all." So with that, I couldn't help but laugh. And he's wonderful, I tell you. So, and he does truly have the patience of Job. I would be amiss if I did not say this, that I could not have done it without Allison Kirby. And I'm not going to look her in the eyes right now because she'll make me cry. But she was a godsend. She was our cardiac rehab nurse. This girl come when she'd get off work, throw me in that shower at the hospital. She would come on my days off, help me get dressed, do whatever I needed to do. She went far beyond the call of friendship, and for that I'll forever be indebted to her. This is my cardiac rehab shot on my first day. I felt like the little girl going back to school because I was so proud of myself. I was happy, I was alive, and life was good. I was doing what my cardiothoracic surgeon said, which was go live. After 13 weeks, y'all know I came back to work, and I worked a week. And I went out, got short of breath at work, went out on August the 14th again, went to the emergency room, went back to St. Francis, and was told that my right graft had blocked off. And so with that, I was headed for a procedure called CTO-PCI, which is chronic total occlusion percutaneous intervention. Big old word for saying we're going to try to unblock your 100% artery again. This is a relatively new procedure. Not very many physicians are doing it in our area, but there was one in our area who was doing it, had like a 70% success rate. So I felt good with that. We went with him, and it was not successful. He was not able to get through. And I can remember going back and thinking, back to the plan that God has. If I can say nothing else, this body is not mine. It belongs to the Holy Spirit. It's Jesus' body. He can do whatever he wants to with it if it's going to bring him glory. And I kept thinking, okay, y'all, God, you got a plan. I know you do, and I'm going to stick with you on this. I really prefer you hurry up and fix it, but, But I knew that he had this happening for a reason. And I remember lying in bed that night thinking, I am going to die. I'm just going to die. And I remember that sweet husband of mine putting his arms around me and saying, honey, you're going to be all right, and you're not going to die, and we'll get through this. God's not finished with me yet. At this point, this was the right coronary artery that was totally blocked. Those are my sweet little wires that stick me every now and then. Dr. David Kinseri, after researching him, is a physician in Atlanta with Piedmont Heart Institute and Piedmont Piedmont Hospital. He teaches nationally and internationally. He's a 93% success rate. I think I helped his rate because he was able to get me open. And if you will see this, this is before and this is after. I had no blood going through that artery, and now I do. So with my 3 bypasses and my 4 stents that I have, I can stand before you today and just give praises to the Lord for helping me with this. There's a lot of stories for the last 9 months, some really funny ones, but for sake of time, because I know we're past time now, and boredom, I'll close with this. There are things in our bodies that we cannot control. But for those that we can control, we need to do so. Ladies, we have a 1 in 3 chance of dying from heart disease. 1 in 3. So go ahead and look at your table and pick out your friend. The one that you think, ooh, okay. Heart disease kills the 1 in 3 ladies. Our symptoms are not the same as men's. Remember the thumb? We need to watch what we eat. We do need to walk past that fast food line. If your waistline is 35 inches or greater, this puts you at a higher risk than most. And we need to take advantage also of this cardiac rehab exercise room when it's not being used for our patients. You know, these things we can control. You can stop your smoking. You can watch your diabetes. You can work on your blood pressure. Because if it's hereditary like mine was, and that was my only risk factor, I can't fuss at Daddy because he's not here and it wasn't his fault, it came somewhere. So if you'll just think about these things. Would I choose this journey? Absolutely no. I would not go out here and sign up and say, I want my heart operated on today. But I have no regret in having gone through this. I have learned so much. I take nothing for granted now. When we lit our little Christmas tree in the big, great metropolitan town of Pendleton, I cried because I thought, I almost didn't see this. And when everybody was fussing last week or week before last about the snow, I thought, I love you, snow. I got to see you again, not from heaven, but still from earth, you know. If you'll remember one thing, nothing, I have always felt and tried to live by this, there is nothing that can get to me that is not first sifted through God's hands. For my good and for His glory. And so for whatever it is, I know that He'll be here with me. And if this is what it takes to give Him glory, my heart surgery, the CTO, then I take that with trust. And maybe through this, someone else can see God's glories. Because I cannot choose my time or the conditions in which I am to praise Him. But I can, however, choose to praise Him because He gave me this particular assignment to best do so. And with that, I know the plans that He has for me. Thank you.